There we go. Okay, hello?
Yeah, can you hear me now?
Yeah, that's much better.
Oh, okay. Hey, okay, so you had time to review the changes or the stuff that we did. What were your thoughts now?
What changes?
The changes from not seeing Dr. to seeing me?
I don't know yet. I mean, I'm a little skeptical because you said you were not going to change any medicine, at least not yet, and you made my Suboxone prescription a week. And that is a change. And you said...
So, for that much Suboxone, we give you a week at a time. I don't really know you that well.
I've been on it for 4 years.
Yeah, but the thing is that we're going to be taking you off of some of that. Taking 24 milligrams of Suboxone for your condition, again, is not the standard of practice, in my community at least.
Well, you know, I ran through a lot of medicine to find something that will take away the pain or perception of pain or whatever you want to call it.
Yeah. I mean, the other side is that every single medicine you take, except for the selegiline, is all controlled substances. And so having that many controlled substances is just not appropriate medicine. For me, I can't maybe convince you of this because this is what you think works for you the best. But I've been doing this for a long time, and I've never had anybody as having this many significant medications that are on board.
Well, three controlled substances. 3 controlled substances.
Yeah.
I've ran into people. I know it's not the most common thing, but if I were to do ECT or the ketamine works or whatever, I'd be open to changes. It's just I'm scared because I've had to scratch and claw for what little I have that works. When you've been on over prescriptions and you're crying every night in bed because your body hurts and you're depressed and the dissociation's so bad,
that's not a reason to be on that many controlled medications.
It is when it makes it less.
It doesn't.
But
it doesn't make it even if you thought that it did work. There's just no way that it makes any sense to have you on this many kinds of medications.
What does it mean? What's the difference between I think it makes me work and it works? Like, even if let's say it was as far as placebo, it still works.
Well, then let's use it placebo.
But, I mean, the mind doesn't work like that, right? Please tell me.
Sure it does. Placebo works about 55% of the time.
Yeah, but not if the person knows.
Well, then you can talk about nocebo, the nocebo effect.
That's not what nocebo means. Are you kidding me?
No, that's what I'm saying. Like, if you don't think it works and it works, or if you think it works and it doesn't work.
Nocebo means negative placebo. It's like getting negative side effects from a placebo. That's not I'm sorry. I don't think you know what you're talking about. I'm just that's not what nocebo means.
I just talked to you about the placebo effect.
You said nocebo is when you know about it?
No, nocebo is the opposite of placebo.
Okay.
But I'm saying you could have the nocebo effect. I don't know why you're...
I thought you were saying something else. Never mind.
Let's say that I did say something that was wrong. Why would you pick that apart and make that as if it's the whole?
Well, I guess because I feel like you're kind of like shitting on my knowledge, shitting on how I got here so far, and it makes me feel like shit. So.
Okay, so how you got here, however you got here, is where you are right now.
Yeah, but I don't need to be like told that I have.
Something. You go around and you spew out whatever knowledge you have as if you're an expert in the field.
I had no choice but to acquire more knowledge or put a bullet in my mouth.
You started talking to me about the kappa receptors of the brain, about how the medication helps with the kappa.
Yes, because I had to do.
What does kappa do? In your mind, what does kappa do for you?
Kappa regulates dopamine.
No, it doesn't regulate dopamine at all.
Sorry. I'm sorry. I have to stop there. You're wrong. That's a joke.
Okay, how does kappa does not regulate dopamine.
Yes, it does. The endorphin system regulates dopamine. This is
And the kappa are all receptors. How does it regulate the dopamine in your mind?
in the nucleus accumbens.
Okay, kappa doesn't work in the nucleus accumbens. Few receptors that work in the nucleus accumbens.
Kappa, but
Kappa
is a
dysphoria. Kappa causes people not to have dysphoria.
no. Kappa causes people to have dysphoria, not to not have dysphoria.
Where does the Suboxone work?
The Suboxone blocks dysphoric effects caused by dynorphin binding to kappa. That's as much as I can tell.
All right, so here we are with kappa, and you said it's very important. When you want to work with someone who's an addict, what you want to do is be able to attack the kappa so they don't have dysphoric effects.
Right, because of increased dynorphin release that's from a homeostatic response to the increased mu activation.
Okay, but the medicine like Suboxone, it affects kappa.
Yes, it blocks it.
Delta. It affects the mu receptors.
It's a very, very minor ligand at the mu receptor, and I can't even feel it because of dissociation.
All right, well, I don't know about that, but I'm talking about just the medication in itself. You talked about the kappa as like a really important thing.
It is.
Naltrexone is probably your better bet.
I've been on naltrexone. I was on 200 milligrams for 6 months.
Well, you look at that, and that's the basic, that's the basic kappa inhibitor.
No. I'm sorry. Suboxone is far stronger at kappa than naltrexone.
What does that have to do with how you decide?
I don't know, but it stops the pain. No other opiate works. I can take Percocet. It doesn't do shit.
Okay. Well, hey, you have the medicine for every week for the next 3 weeks. Same dose. If you don't like the way I practice, find somebody else.
Well, you took my doctor away.
That's because he was doing inappropriate medicine with you.
So wait, it's your combination. If you don't like it, find someone else. But I'm going to judge how he was doing medicine. So now that I've shat on everything you're doing, you can walk away now.
What you did was you bamboozled a doctor.
I bamboozled him. He has free will, man. He can say no.
You say, this is what I need. He had no intention of wanting to give you this.
Then he shouldn't have done it. And you interfered with everything. You said, hey, I'm going to take over, and now you're saying, so you're giving me 3 more weeks of hold on, Dr. Melden. You're giving me 3 more weeks of Suboxone, and then you're taking me off it? Is that what you're saying?
Yeah. Yeah, I'm going to be down titrating you. And in fact, we're going to be working toward the naltrexone effect.
No. You're completely disrespectful.
I don't think so. I think it's I don't think it's disrespectful at all.
I've been on naltrexone and other prescriptions.
Ultimately, what I did was I have control over these meds now because what was going on before was out of control.
No.
And having that doctor being put on the cutting block for a malpractice suit was highly likely by the way the medicines were being prescribed to you.
But it didn't happen.
Whatever happening could have happened because
coulda. So you basically believe nothing that I say. You don't care how much pain that will cause me.
I haven't talked about like the alternative here. The job.
I can't function without Suboxone.
Well, you're going to have to in the next 3 to 5 weeks.
I'm going to find another doctor, and I'm going to. I did not give you permission to call doctor.
I don't need permission to call any physician to do the doc for you. It is not.
Well, you're no longer my physician.
What?
Well, you're no longer my physician.
So you're going to fire me now?
Yes, because you have no respect for what I've been through.
If you really want to get better, I would suggest you don't fire me. If you really want to get
If you want to get me better, I suggest you at least respect what I know, how I got here, and what I've been through. And not just think I'm just some random patient who's just read a few articles on some blogs and talks out his ass.
Well, I think in some ways you don't have the knowledge to really understand how this stuff works because
you told me. I beg to differ. You told me kappa doesn't regulate dopamine. The dynorphin system regulates dopamine.
Okay, so when you say regulate, you and I might be talking about 2 different words because when you say regulate, I'm talking about how you can regulate the amount of dopamine that goes into an area.
Yes, that's the dynorphin system. Dynorphin inhibits the release of dopamine.
Why are you arguing about cyclopharm?
Because I'm using it as a point to show you that you telling me what I don't know what I'm talking about is ludicrous when you don't have these basics facts straight about how these systems work. And then you're taking me off my medicine based on the facts that I don't know what I'm talking about. And then you're proud to have taken my medicine away to another doctor. And you don't care how it makes me suffer.
You sound like a drug addict.
Okay, that's fine. I don't care what I sound like to you. I've been through hell and back. Okay?
You're back.
What?
You're not back. How did this ever...
No, I'm not. But
the next step you want to do is get ketamine. You say, okay, I want ketamine because I'm not doing well.
that was Dee Dee's recommendation for 6 months. She insisted on it. That's why she sent me to you.
Who?
Dee Dee.
Oh.
That was the reason I'm with you, not for you to interrupt my whole life, but for you to get me ketamine. It was her idea. She told me for months and months and months and months that I should do it. So I finally did, and this is where I am. Now I'm being called a drug addict because I listen to my fucking doctor.
I said you sound like a drug addict when you're buying this hard to get Suboxone. If you wanted to be...
And if you gave me heroin, I would not be satisfied. Okay, it has to be Suboxone because of the kappa antagonism. I don't care about the mu effects or any of that garbage. Okay, it has nothing to do with getting high. You can give me naltrexone and Suboxone because the kappa antagonism is stronger. I don't care about the mu effect. I don't care about getting high. I don't want to suffer.
That's what they do. That's what they do with people that have drug dependence. They give a little bit of Suboxone and they give naltrexone. That's exactly what they do.
I just need to stay on the Suboxone.
Okay. At 8 milligrams 3 times a day, you're not going to stay on Suboxone at that dose. Never.
Twice a day?
There's no doctor that's going to give it to you.
I've had it. I've had multiple doctors. It's just that did it for free where I had to pay $150 to $300 a month, but I've had multiple doctors who did that.
So basically you're paying another doctor to prescribe you medicine.
That's most Suboxone providers charge. Out of pocket, don't take insurance. I had a bunch before.
Hey, you have 3 weeks to fire me. Okay, go ahead. Go to town. Figure it out. Otherwise, we work my route, which is trying to control some of these symptoms, your dissociation, some of these personality issues, get you some therapy, see about ketamine, see about ECT. I mean, if you want to go down this route, that's fine with me. But if you want to go down your route, go ahead. You have 3 weeks. Every week you can get your Suboxone filled. And then you're going to have to figure this out.
How soon can I get the ketamine or ECT?
I don't know. Did you meet with Rachel?
What?
Did you meet with Rachel?
Who's Rachel?
Rachel's the ketamine provider. I mean, no, she's the Spravato provider.
I think I vaguely... Did I talk to her or did an alter ego talk to her? I don't know. What was I supposed to do?
I don't know. And then the ECT, we're working with Sharp Hospital. Thinking about Sharp Hospital.
Have you contacted them? Did they contact you?
We contacted them for you.
And what did they say?
We're working on it.
So it's in the process of being done?
I don't know if it's going to get done. I think your insurance is the biggest barrier we have. I think you have a Medi-Cal carve out, and I don't think that they have the ability to take Medi-Cal for ECT, but, we're working on it.
They said so at Sharp Grossmont.
That's what you said. I have my staff working on it. Okay? So, listen, 3 weeks. You have 3 more weeks. You get 8 milligrams 3 times.
You lied to me, by the way. I just want to... You told me you weren't going to change my medicine.
Not only did I lie to you, I'm also not really good at cyclopharm.
No, you're not.
And you know what? I'm a straw man for you. You can make the fallacy of me being the straw man for you all day long. But
you did lie to me. It's not a straw man. It's the truth. You told me you weren't going to change shit, and you did.
This is all your fallacy.
Did you or did you not tell me you weren't going to change anything?
I didn't change anything. But it's time limited.
What's the difference?
Well, the difference is you have a chance to go find another doctor that will be willing to prescribe this.
I had one. You took him away.
Because he didn't want to prescribe you anymore. I didn't tell him not to see you. He said he couldn't take it anymore because you go in his office and talk about kappas and mu's and deltas like you knew what you were talking about. He didn't think that you knew what you were talking about either, and you think you know. You're the only person.
That's the opposite of what he told me. He said I had no excuse for not going to med school.
Okay, then go to med school and prescribe yourself stuff.
You know,
I'm not. You know, the thing is,
prescribe yourself stuff. You're a jerk.
But the thing is, hey, I'm not telling you, and I'm not thinking that you're dumb. I just think that you don't have enough knowledge to understand what you're really talking about. And so when you sit there and tell me how much of an expert you are, then wait till you go to med school. Take the biology.
I can't because I can't.
Take all those courses.
It's no point. You can't go to med school with fucking DID.
Well, you can't go to med school with this fucking whatever's going on right now either.
The DID is my problem. The DID is what causes the pain somehow.
No problem, then you get it fixed with therapy.
I've been in therapy for 3 years.
Not the kind of therapy that I would recommend.
What kind of therapy?
For 3 years, I'd recommend some trauma stuff. I'd recommend some like prolonged exposure and EMDR and stuff that can help you with this and get you on some propranolol and get you.
I've been on propranolol.
Get you on some glutamate modulators.
I've been on. Name something you think I should be on, and I'll tell you.
To mankind, and this is where we are.
What?
Because you know more than anyone.
No, I don't. Go fuck yourself. How dare you?
Hey, you can go yell at me and...
Yeah, and I could put this on Yelp, this conversation.
It wouldn't be the first time. So go ahead.
I will.
I'm not here to like try to cover my ass.
Yeah, you're mocking me. You're mocking me.
No, I am challenging.
No, you're not.
Yes.
You are a jerk. That's it. I don't need any excessive cuss words. You're just a jerk who likes to take control.
Why don't we get your mom and dad or whoever else is in your life? Why don't we get them on this conversation with us? Let us all talk together, people who know you really well, and why don't we have a real conversation about this whole thing? Because if you want to do that, I'm open to it. Anybody?
I'm not going to bring other people. I'm not going to bring the people I know to a person who mocks me in our second appointment.
Okay, see, that's the whole thing. I think that if you were to hear everyone talk to you really truthfully about what they think, I think that you would hear that you're the one that needs help.
I do need help, but I don't need help like this.
But not the help that you think.
No. I am perfectly willing to change and open. I am just not going to sit here and be mocked.
Okay, when you say mocked, I'm not mocking you.
Yes, you did. You can go prescribe yourself stuff. You know, like...
You tell me you could go to med school. Where? When? How? You know, you're like this legend in your own mind.
No, I'm not.
You got this idea about your intellect and how smart you are, but here we are trying to talk about just the nuts and bolts of getting you better.
You have, I will tell you why you're full of shit. Because you didn't ask me anything. You didn't ask what I've been through. You didn't ask what I've taken. You didn't ask how I got here. You showed no sign of respect.
So, you know anything about trauma and trauma therapy?
Yes.
Okay, I would never ask you those questions. You know why?
No, I'm not asking you for. I'm talking about I'm talking about the treatments I've gotten, the therapy I've gotten, what I've tried, what hasn't worked. I'm not asking you to ask about my traumas.
Okay, so I should ask you what has worked and what hasn't worked for you, even though I run entire programs on helping this kind of stuff get better. Like it's anything, you should be asking me what I can do for you. Not telling me what you've been through and what didn't work or did work for you, because I have no idea what's going to work for you. All I know is that we can create a road and a road.
You're telling me I should when you tell me things I've been on propranolol, I was on
You've been on propranolol, but now you don't even want to try it because you've been on it once before.
No, I've been on it multiple. I'm not unwilling to try it, but you act like you have these magic solutions that are going to work where nothing else has before.
I've never talked to you about magic solutions. It's a process. Right now, we're only engaging in the beginning of the process because you and I don't have a very good therapeutic relationship.
Because you talk down to me.
Okay. Because I talk down to you because you think you know more than you actually do.
And your evidence of that is that I'm a patient?
The way you describe what's going on with you and how you're going to fix it.
I don't know how to fix it. If I knew how to fix it, I wouldn't be talking to you.
Okay, you told me that this Suboxone was the only thing that ever worked for you.
Yes.
Okay, but here you are.
Yeah, I mean, work, as relatively speaking, work to not make me want to hang myself every day.
So listen, why don't we get on the phone with your parents or whoever loves you, whoever cares for you, and why don't we all have a conversation about this? Because I think that they would more agree with me than they would agree with you.
So, what are you looking for exactly?
I'm looking for an intervention that I can't find.
It sounds like you have drawn conclusions. Look, what I'm looking for in a doctor is someone.
I drew a conclusion that you have parents. Am I wrong?
No, you have drawn. That's not the conclusion you drew. You've stated your conclusions. You stated your conclusions that I'm up my own asshole, that I'm like a legend in my own mind was the way you put it.
Yeah, I did. You and I went to the same, right? You went to, is that right?
Yeah.
Okay. Did you graduate cum laude?
No.
All right. I did.
Congratulations.
Okay. And I also graduated in biochemistry.
Congratulations.
What did you graduate in?
Cognitive science.
Okay. Cognitive science. Which school? Which one? Okay. So, listen, you and I, we probably took the same subject. We kind of had some crossover subjects because my minor was psychology. I studied really hard. I graduated. I went to med school. I studied really hard. I went to go do a fellowship in biochemistry. I worked really hard. I worked really hard all the way through.
And your
I worked
point?
for a pharmaceutical company, making drugs. I worked really hard. So all this stuff I do, I came here, and now I'm with you, who's telling me about kappa, mu, and how they regulate dopamine.
Uh-huh.
And then I want to know, is like, look, you're not the first person I've dealt with that had somatic pain, who've had pain that no one else could cure because they kept throwing medications at you. But what I had inherited was a guy that's on 3 controlled substances, and here we are trying to figure out how I can get this thing in a better order, which makes more sense. Suboxone's not the thing I would fight with you over the most, but here we are.
I don't look. If you are just, I will fire if you're going to treat me as absolutely ignorant.
Okay, when you say you're absolutely ignorant, did I ever say you're absolutely ignorant?
The way you speak to me,
You have overstated what you actually know about things. You have come across like you know more about these things than any doctor that's ever taken care of you.
Most, yes, not all.
Okay, so there's a problem here with your ego.
But you're the one who's bragging about graduating magna cum laude. You know, magna cum laude, and like, you know, I admit there are parts of me that have an ego problem, but I think we're in the same boat, don't you?
Okay, so where we are.
No, hold on.
Okay, I have to go because I have another client. I have to go because I have another meeting. Okay, you have the ability to figure this out.
No, I'm probably.
Each week.
Like, when can I start the ketamine?
I don't know. Talk to your alter ego. Talk to whatever you want to talk to. My staff. Talk to whoever talks to my staff. I don't know. I say yeah.
Who do I talk to?
I don't know. I'll figure it out.
Wait, no. You told me Rachel something?
Hey, you've taken way too much of my time as it is, and I want you to be respectful of my time because I have other things I got.
I need to know a name.
Rachel, who would be the consult, and Erica would be the one that would be setting you up. Okay, I'll see you in about 2 weeks.